Okay, so I performed my leak test, which I passed that. And I also performed my flow sensor test and passed that. And I also connected my inspiratory side, expiratory, my flow sensor, my HME, and my Ballard. So now I'm going to check my patient's chart and check the physician's order. This is a 60-year-old female with COPD, with a history of COPD. The indication for this would be to improve ventilation and oxygenation. So I'm going to wash my hands and put on my gloves. Okay, I'm gonna knock on the door. Hi, Miss Haley. My name is Terry with Respiratory. Can you identify your name and date of birth for me? Patient is unable to do that, so I will check the bracelet to make sure it matches all the data in the computer. Okay, I'm going to explain the procedure, which is, indication would be to maintain ventilation and oxygenation. And then I'm just going to... So the purpose of putting a patient on mechanical ventilation is to improve oxygenation and correct acid-base balance. A risk would be oxygen toxicity, but we'll titrate Miss Haley's FiO2 to maintain her saturation within normal ranges. So I gather all my equipment. I make sure there aren't any leaks. I check the oxygen source, which is hooked up to a 50 psi. This is connected to a red source. I'm going to make sure I have my ambu bag, my suction with my Yankar, my emergency airway, my stethoscope, my HME, as I stated, my bacterial filters, flow sensor, and my suction. And now I'm going to put in my settings. Let me get my patient's chart. Okay, so controls, female, patient is 65 inches, and then I'm going to go to mode, APV, CMV, and okay. Patient's rate going to be 12. Our time is 1. Tidal volume is going to be 450. Peak 5. Oxygen FiO2 would be 40, but for video purposes to preserve oxygen, we're going to set it at 21. And then I'm going to start ventilation. Okay. And now I'm going to put in the patient's alarm. Okay, we have a high pressure of 40. The minute ventilation is going to be, the high minute ventilation is going to be 20, which is already set. The low minute ventilation is going to be 4. The rate is going to be 40. And then the minimum for the low minute ventilation is going to be 10. Tidal volume is set to 1,000 for the high, and low tidal volume 400. Okay. And now I'm going to check on the patient. I'm going to listen to breath sounds in 6 different places. Okay, patient has equal bilateral breath sounds. I'm going to check the tube placement, which it looks like 26 at the lip and 27 at the teeth. Patient's heart rate is 75. Oxygen is 99. Blood pressure is 120 over 81. Temperature 37.5. Patient looks pink, so color is fine. We have chest rise. Okay, so I checked the cuff pressure, which was 20 to 25 centimeters of water. ETT was secured, and I ordered a chest x-ray and confirmed that it's in the right place. I did obtain the ABG 30 minutes after the patient was placed on mechanical ventilation. We did need to correct the patient's acid-base balance. To do that, I'll increase Miss Haley's FiO2 to improve her oxygenation. And then I'll go in and change her heart rate. Not her heart rate, her respiratory rates, to improve that as well, improve her oxygenation. And now I'm going to make sure patient is fine, make sure Miss Haley is fine. I'm going to take off my gloves, wash my hands, and chart everything, such as the ETT placement, vitals, breath sounds, any changes that I made within the patient. And that's it.